One of these two Medicare plans could leave you owing over $9,000 in a single bad year, and it's the one with the smaller monthly bill. Now, there's a reason for that. A Medicare Advantage plan replaces original Medicare completely, taking over your coverage on its own terms. A Medicare Supplement plan works alongside original Medicare instead, so you keep Part A and Part B, and the supplement covers what's left. By law, you can't have both at once. Medicare Advantage often costs nothing extra beyond Part B. Most plans even fold in drug coverage, plus dental, vision, and hearing. But there's a catch. You're on a network, referrals are common, and real care can mean $200 to $400 a day in hospital copays or more. A Medicare Supplement plan flips that trade. You'll pay more upfront, $80 to $300 or more a month. But after your one Part B deductible, that's it. Plan G covers everything Medicare approves at any doctor or hospital that takes Medicare. You won't need a referral, and there's no network to fight. Picture a real year, 5 days in the hospital, a handful of specialist visits, one outpatient procedure. On Medicare Advantage, those copays and coinsurance add up to about $3,000. And that's despite a premium that didn't cost a thing. On Medicare Supplement Plan G, that same year costs $1,800 in premiums, plus your one Part B deductible. That's about $2,000 total. Same care, and the supplement plan comes out roughly $950 ahead. Flip it around, in a light year, Advantage wins because you skipped that premium. A supplement plan gives you one guaranteed shot during a 6-month window. It starts the month you turn 65, as long as you're already enrolled in Part B. From there, it's 6 months and that's it. Miss it, and most states can put you through medical underwriting. Health questions, your medical history, a look at any pre-existing conditions, all before they'll sell you a policy. It can mean a higher premium, a waiting period, or a flat denial. Neither plan's wrong here, it just comes down to what you value. If you want your worst-case cost locked in and the freedom to see any doctor, that's a Medicare Supplement plan. If a lower monthly bill matters more and you're comfortable with a network, Medicare Advantage can work well. Visit MedicareCompared.com. A licensed agent can compare both against your own health and budget. It's free. If this video helped you, hit that subscribe button and drop a comment below if you have any questions, because when it comes to Medicare Advantage and Medicare Supplement, the best choice isn't the smaller monthly bill. It's the one that fulfills your needs and your care.